Hello everyone, welcome to Deroofing Dentistry. This is Dr. Khushali Arora and today we are starting with nomenclature. So before we start, just tell me something. Suppose you enter a classroom and everyone has the same name. It would be very confusing, right? Similarly, every tooth also needs a proper name for its identification, and that naming system is called nomenclature. In dentistry, a tooth is named according to the arch, side, type of tooth, and position from the midline. Sounds complicated? Don't worry. Once we'll break it down, it becomes very easy. Okay? So, why do we need to study all these names? Why do we need to study this nomenclature and why do we need to name all these teeth? Okay, so because nomenclature is used everywhere in dentistry, it helps in identifying teeth. So, helps in identifying the teeth and recording dental findings, writing prescription and writing case sheets, and communicating with other dentists, then radiographic to study radiographic interpretations, and finally for treatment planning. Okay, for example, if a dentist says caries in mandibular left first molar, every dentist immediately understands exactly which tooth is affected. Without nomenclature, there would be confusion and incorrect treatments. Now, basic terminologies used in nomenclature start with the dental arch. So, what is an arch? So, here, if you can see, the teeth are arranged in the curved form in our jaws, right? And that curved form is called dental arch. We have two dental arches. The maxillary, that is the upper dental arch, and the mandibular, that is the lower arch. Okay, so we have two arches, the maxillary arch and the mandibular arch. Maxillary arch is also called the upper arch, and mandibular is also called the lower arch. Now, maxillary teeth are referred as maxillary central incisors, maxillary canine, maxillary premolars, and so on. And same with mandibular teeth. They are referred as mandibular molars, mandibular premolars, and so on. Okay. Now, important clinical point for the arch is, so maxilla is fixed while mandible is movable. So, mandible is movable. So, all the movements during mastication and speech are performed by the mandible. Okay. And now, our second terminology is midline. So, now imagine an imaginary vertical line passing exactly through the center of the face. That is what midline is. Okay. Midline divides the mouth into the right and the left half. So this would be the right and this would be the left half. Now you must be thinking that I made a mistake and I wrote this incorrectly. But this is important to understand that the right and the left side are from the patient's perspective and will always be from the patient's perspective and not from ours perspective. So if you're standing right in front of a patient, your right side is not the patient's right side. Okay. And I think that is all about the midline. Now we can go on to the type of teeth. So I'll just use this same picture here. So we basically have four types of teeth. Let me just write it down here. Incisors, canine, premolars, and we have molars. Okay, so the incisors are the front teeth. As you can see here, these are the incisors. Okay, their function is cutting food and they have a sharp incisal edge which helps them to cut the food. Okay, there are two types of incisors. Okay, we have the central incisor and we have the lateral incisor. The central incisor is closest to the midline. As you can see here, we have our midline here, and this one is closest to the midline, and the lateral incisor is next to the central incisor. Okay, and these are the teeth. Incisors are the teeth that are most visible during smiling. Okay, so these are very important for aesthetics, speech, and biting actually. So for speech, try pronunciating F and V sound. So these sounds will be very difficult to pronunciate, or we would not be able to pronunciate F and V sounds without our incisors. So these sounds depends on the incisors. Now we can move on to canines now. As you can see here, this one is the canine. That is, canine is located right next to the lateral incisor, and their function is tearing food. So I'll just write it down. Incisors function was cutting food. Canine's function is tearing food. Okay, and their features are strong single pointed cusp. Then they have longest root in the oral cavity, and they are the strongest teeth for guidance during the jaw movement. Okay, so canines have a single cusp, and so they are also known as cuspids. Okay, they have the longest root in the oral cavity and strongest teeth for guidance during the jaw movements. And canines are actually also called as cornerstones of the dental arch, because they provide strength and stability. Okay, I think, yeah. So now we will move on to the premolars, and that was basically everything about the canine. So now premolars are located behind the canine. They are 2 in number on each side of the arch, and their function is crushing and grinding food. So I'll just write it here. Crushing and grinding food. Okay, and then they usually have two cusps, the buccal cusp and the lingual cusp, and so they are also called bicuspids. Okay, because they have two cusps, they are also called as bicuspids. Now, important point regarding the premolars is that premolars are absent in primary dentition, and the primary molars are later replaced by the permanent premolars. Okay, so premolars are absent in primary dentition. Now you must be thinking, what is this primary dentition? And so, but I'll explain this to you just now, like after we finish the types of teeth. Okay, and yeah, so premolars are absent in primary dentition. Okay, now we have our fourth type here, that these are the molars. You have it right here. So they are located at the very back of the mouth. Okay, and their function is grinding food. So I'm writing it down here. Their function is grinding food. Their features are, they have a broad occlusal table, they have multiple cusps as you can see here, and they have strong roots. Okay, and molars handle heavy chewing forces. Okay, and I think, yeah, that was about the molars, like a little bit about the molars. We'll study each type of tooth in detail later in our videos. Okay, now about the dentition. So we have two types of dentition. We have primary dentition which you can see here. Now, must be able, like, can you tell me why I am calling this dentition primary dentition and not permanent dentition? I just told you a point that something is missing in the primary dentition, right? So, what is missing in the primary dentition? Which type of tooth is missing in primary dentition? I think most of you might be able to guess it. So, premolars are absent here. Okay, you can see we have canines and then we have molars here. So we don't have a premolar in between them. So this picture is a primary dentition. Primary teeth are smaller in size as compared to the permanent teeth. They are more whiter in appearance as compared to the permanent teeth. And primary dentition is also called deciduous dentition or milk teeth or temporary teeth. Okay. They contain 20 teeth. The primary dentition contains 20 teeth and which starts erupting around the age of 6 months. And importance of primary dentition is they are extremely important during mastication, speech development, facial appearance, and guiding permanent teeth during eruption. And premature loss of primary dentition can lead to malocclusion in permanent dentition. Okay, and yeah, and then we have our permanent dentition right here. So permanent dentition contains 32 teeth. Okay, just fix it. Permanent dentition contains 32 teeth and which begins erupting around 6 years of age. Okay, and this includes premolars. The permanent dentition includes premolars and the third molars as well, while in primary dentition you'll only find 2 molars, like first and second molar, while here you'll also find the third molar in the permanent dentition. And permanent teeth are larger and more mineralized as compared to the primary teeth. Okay, that is basically everything. Like just for an intro, that was everything about the primary and the permanent dentition. Okay, so our next topic is tooth position from the midline. Now this is very important in nomenclature, and the teeth are named according to their position from the midline. So as you can see, we have our midline here, and I think I already told you about the central and the lateral incisors, but I'll just repeat that. So this one is the central incisor and the second one is the lateral incisor. Now the central incisor is called central incisor because it's closest to the midline, and the lateral is named so because it's next to the central incisor. Okay, then we have premolars here. So we call them the first premolar and the second premolar. Just because we call the first premolar so because it's closer to the midline. Okay, and the second premolar is away from the midline. It's a little bit away, like it's next to the first premolar. That's why it is second premolar. Now same with it will be. This is the same thing with the molars. We have first, second, and third molar, and they are named according to their position from the midline. And I think this is very simple, like why they are named like first and second. So now you'll be able to answer that. The first premolar is called the first one because that is closer to the midline, while the second one is away from the midline. Okay, and same with the molars. Now about the complete tooth nomenclature. Okay, so we are going to combine everything whatever we have studied like till now. So a complete tooth name includes the arch, the side, the position from the midline, and the type of tooth. Okay, and so I'll give you two examples. So our first example here is maxillary right central incisor. So let's try to break this down. So this is how you'll name your teeth. So first will come the arch, then the side will come, then the position from the midline, and then comes the type of tooth. So now, so this is the sequence. Okay, just make sure you remember this. This will be the sequence always. Okay, the arch will come first, then side, then position from the midline, and then the type of tooth. So this is our first example here, maxillary right central incisor. So we are talking about the maxillary arch, and we have our maxillary arch right here. Okay, then we have this right side. So this will be the right side according to the patient's perspective. So right and left. So will be talking about this half. Okay, and then we have central and incisor here. So central means it's closest to the midline. So we have our closest teeth to the midline here, and this is an incisor. So yeah, this was very easy, right? I think you'll be able to identify your teeth from the name. Okay, if I'll give you a name, then you'll be able to identify. So I'm gonna give you a name. I'm just gonna wipe this off, and I'm gonna give you a name, and you are gonna solve that on your own. So maxillary left first molar, maxillary left first molar, and you'll be doing that on your own. Okay, so now our next terminology is tooth surfaces. So I'm gonna draw the midline here. We already have it. So this picture, I have taken this from Wheelers, and if you want to refer to your Wheelers, you can definitely go back to this picture and refer it. Okay, so now we have 5 surfaces. I'm gonna write this down here. So we have mesial, distal, labial or buccal. We have lingual or palatal. Then we have our occlusal surface or the incisal surface. Okay, so the mesial surface, one by one. Mesial surface. The mesial surface is the one that's towards the midline. So this surface will be your mesial surface, the one that's towards the midline. Okay, then we have our distal surface. Distal surface is the one that's away from the midline. So this one is away from the midline. That is your distal surface. Now we have our labial or the buccal surface here. So the surface that will be towards your lip will be your labial surface, or actually their common name is facial surface. Okay, and yeah, so the facial, that is towards your outer, like the outer face, that will be your facial surface. Now we have labial and buccal surface. So one that's towards the mucosa of the lip is your labial surface, and then the one that's towards the mucosa of your cheek, that is your buccal surface. Okay, so in the posteriors you call it buccal surface, And in the anteriors, you call it as your labial surface, and in common, that's the facial surface. Okay. Now, we have your lingual or palatal surface. So the surface that is towards the tongue will be your lingual surface, and then that will be, you'll call it lingual surface in the mandibulars, while in the maxillary teeth you'll call it your palatal surface, because you'll have your palate here. Okay, you have your palate here, and that surface which is towards your palate, that will be your palatal surface, and then the one in that's towards your tongue in the mandibulars, you'll call it your lingual surface. Now we have your occlusal surface or the incisal edge. So to find incisal edge here in the anteriors, okay, we call it incisal edge because we have very thin edge in the anteriors. Okay, and then in the posteriors you have a table, okay, which is going to oppose your mandibular teeth, like, or the opposite opposite arch, and that is your occlusal surface. Okay, so that was very easy. We have your mesial surface that is towards your midline. We have your distal surface that is away from the midline. We have labial surface that is towards the mucosa of the lip, and the buccal surface that is towards the mucosa of the cheek. Then we have your lingual and palatal surface. The lingual surface is, you'll call it lingual surface in the mandibulars, while the palatal surface in the maxillary teeth, which are facing the inside of the mouth. Okay, then we have your occlusal and incisal edge. So incisal edge in the anteriors, because we have a very thin edge here, and the occlusal table in the posteriors. Okay, and now, okay, so that was pretty much everything about the nomenclature. Let's do a quick revision and see what we learned today. So today we learned about nomenclature, what it is, what nomenclature is. Then so nomenclature is naming system of the teeth. Okay, then teeth are named by its arch, side, position from the midline, and the type of tooth. And this will be your sequence while you are writing down the name or calling it out. So this will be your sequence. Okay, and then we learned about the arches. So we basically have two arch, the maxillary arch, which is the upper arch, and the mandibular arch or the lower arch. Okay, and then we learned about the type of teeth. So we basically have four type of teeth: the incisor, canine, premolars, and molars. Okay, and then we learned about the dentition. So we have two type of dentition: the primary or the deciduous dentition, and the permanent or the succedaneous dentition. Okay, then we have we learned about the specific surfaces of tooth. So the surfaces are mesial surface, distal surface. The mesial surface is towards the midline, distal is away from the midline. Labial or the buccal surface, the one that is facing your mucosa of the lip or the mucosa of the cheek. Then we have your lingual or the palatal surface, and then we have the occlusal surface or the incisal surface. Okay, and that is basically everything, like a quick revision of what we learned today. And yeah, and to conclude, nomenclature is the language of dentistry. Without nomenclature, communication between dental professionals would become very confusing and inaccurate. A proper understanding of nomenclature will help you identify teeth correctly, describe lesions accurately, and communicate professionally in clinical practice. So before studying advanced dental anatomy, always build a strong foundation in terminology and tooth identification. Thank you everyone for your time today. Hope you liked my video. So subscribe my channel, share my videos, and please give me a thumbs up. Thank you. Bye bye.